Hi everybody, this is Professor Wells, and this week we're going to go over Chapter 4, the general handling and safety of dental materials in the office. The dental office uses a wide variety of materials that contain chemicals. We must know how to correctly manipulate, clean up, and dispose of these materials. Most of these materials have chemicals that are capable of producing harmful effects if they're not handled properly. Safety is one of the #1 things that we touch base on, especially in the clinic here. And the 5 job-related hazards that we come into contact with are exposure to particulate matter, mercury, the toxic effects of the chemicals, airborne contaminants through aerosols, and biological contaminants. Something I found pretty cool, actually not cool, but in 2018, they made a list of the top 47 jobs that were bad for your health, and this was #1, dental hygienist. I wouldn't necessarily look at the salary here. I think that's kind of based off of somewhere like California where the cost of living is a little higher. But look at the top 3 health risks. Exposure to disease, it was 100%. Exposure to radiation, 91, because we're constantly taking x-rays. And then time spent sitting, it scored an 85, because sitting's the new smoking. That's something really important to realize that, you know, part of the job we sit a lot. So we need to make sure that when we're not working, that we're getting up and being active. So with COVID coming about, this also produced a new chart, the occupations with the highest risk to COVID, and we are #1 again. We scored a 99.7, partially because we are working in the patient's mouth, we're creating aerosols, we come into contact with saliva and blood and things like that. But, you know, now that this kind of put us on the map with this, not that we weren't there to begin with, but it made people more aware of how dangerous our job actually is. The manipulation of dental materials, especially dry powdered materials, may generate particulate matter. Matters like alginate, pumice, microblasting materials like with the air polisher, these can generate dust during manipulation and handling. The dust can then be inhaled when exposure occurs, and this causes damage within the lungs. So what is pneumonicosis? This is a fibrotic lung disease that can be caused by chronic exposure to the dust generated in the manipulation of dental materials. PPE should be worn at all times to inhibit exposure to chemical agents. The PPE that should be worn includes dust or surgical masks, eyewear, gowns, and hair coverings or tiebacks when appropriate. Exhaust ventilation systems in dental labs where grinding or trimming of materials is performed is equally important. The other thing that is going on with COVID, I'm sure you all have noticed, we've had to start wearing more PPE, and it's more so that we're protecting ourselves. We were always good with keeping the patient safe and things sterile for the patient, but we kind of did a not so good job of protecting ourselves. Microorganisms like blood, bodily fluids, and oral and respiratory secretions are present during patient care. Microorganisms may contain hepatitis B, hepatitis C, and HIV, and other viruses and bacteria. Dental personnel can be protected from the occupational transmission of infectious diseases through strict adherence to the requirements of the Occupational Safety and Health Administration, or OSHA, and the Canadian Center of Occupational Health Bloodborne Pathogen Standard, and to the infection control guidelines issued by the CDC. Another excellent resource for the dental team is the Organization for Safety, Asepsis, and Prevention, which is OSAP. I'm sure you guys have heard a little bit about that. In addition, most US states have regulations specific to infection control for dentistry. Areas and equipment in each area must clearly be marked so that dental personnel know which area or item is potentially contaminated and can take the necessary precautions in handling an item. If you're unsure, use a protective covering or disinfect the item with the appropriate germicide. The way that I look at it, if you don't know, I assume everything is dirty. Even if it's clean, assume it's dirty. There's nothing wrong with going an extra step and cleaning something that you are unsure of. Bioaerosols in the dental setting. So let's break down what bioaerosol means. Bio means living, aerosol means mist. So bioaerosol, living mist. A bioaerosol is a cloud-like mist containing microbes such as bacteria, viruses, molds, fungs, and yeast. Dental bioaerosols and splatter are more common due to the fact that these aerosols contain oral fluids, blood, dental materials, powder, latex particles, and dust from metals. Particles that exit the patient's mouth during many dental procedures can be separated into two categories: splatter, with particles larger than 50 microns, and aerosols, particles smaller than 50 microns. The bioaerosols and splatter created by the dental handpiece, ultrasonic scaler, and by air abrasion procedures can contain particles of human teeth, oral fluids, bacteria, viruses, old restorations, lubricating oil, and even abrasive powder. This figure shows aerosols and droplets generated by the ultrasonic scaler. Methods to reduce bioaerosols include the high vac suction, pre-procedural rinses, cleaning the air filtration system frequently, using vacuum dust collection systems, using rubber dams, pre-procedural removal of biofilm, wearing proper PPE, keeping containers tightly covered, pouring chemicals rather than spraying, and using lids on ultrasonic cleaners and other chemical containers. The dental professional must know how to correctly manipulate and handle chemicals. A hazardous chemical is defined as any chemical that has been shown to cause a physical or health hazard. They can catch fire, react or explode when mixed, or be corrosive or toxic. What are some ways that these chemicals can enter the body in the dental setting? The skin is the first barrier of defense against chemicals. However, some chemicals are absorbed through the skin. The skin must be in direct contact with the chemical for this to happen. Absorption also may occur directly through breaks in the skin, such as small cuts, open sores, or inflamed hands. Chemicals may also splash into the eyes, which can result in permanent damage or even blindness. In a case of exposure, flushing the eyes at the eye wash station for at least 15 minutes and immediate medical attention is recommended. Inhalation of gases, vapors, or dust of materials is a common route of chemical exposure for us dental personnel. Some chemicals can cause damage directly to the lungs in the form of pneumonicosis. Ingestion is another method of exposure. Eating in an area where chemicals are used to store, or eating with hands that are contaminated with chemicals is a common way of ingesting harmful chemicals. This is why we don't like food back in the clinic, or even your Starbucks drinks or Dunkin' Donuts. You keep those at the front office. BPA is a chemical that is thought to act as a weak estrogen hormone. This chemical is used in the production of polycarbonate plastics and epoxy resins found in a wide range of everyday use products. A form of this epoxy resin is used in some dental sealants and composites. There are 4 recommended steps to reduce the incidence of BPA exposure during sealant and composite placement. Each step is also important for a successful restorative result. Properly cure the resin. Undercured resin releases BPA. Wipe off the uncured smear layer after curing. This reduces the BPA exposure by 95%. Use good placement techniques with rubber dam isolation or four-handed dentistry with a high volume suction. Use high volume suction when adjusting sealants, composites, or orthodontic brackets. There is a known health risk to dental healthcare personnel from exposure to mercury. Taking precautions to eliminate exposure to the dental personnel using mercury-containing amalgam procedures is essential. These precautions are in the dispensing of the material, the placement, the condensing and carving of the material, handling and storage of amalgam scrap, and also the removal of existing amalgam restorations. Precautions when working with mercury: work in a well-ventilated space and avoid direct skin contact with mercury. You don't want to inhale the mercury vapor, and you need to store it in an unbreakable, tightly sealed container away from heat. When you're preparing amalgam for restorations, use preloaded capsules. Reassemble the amalgam capsule immediately after dispensing the amalgam mass, and if you have a spill, use the appropriate procedures to clean the equipment. Chemical toxicity is classified by length of exposure, dose, and frequency of exposure. Acute chemical toxicity results from high levels of exposure over a short time. This is frequently caused by large chemical spills in which the exposure is sudden. Symptoms include irritation, nausea, dizziness, vomiting, headache, and fainting. Chronic chemical toxicity results from repeated exposure, usually over a longer period of time at a lower dose. This can actually occur over months and years. So the effects of chronic toxicity can include cancer, neurologic deficits, and infertility. PPE, there is a reason that we wear it, guys. Hand protection, you wear latex or vinyl gloves are used during patient care. Typically, they don't provide adequate protection when chemicals are handled. When exposed to certain chemicals, the latex and vinyl gloves actually degrade and they can pull contaminants and chemicals through the gloves. Chemical resistant gloves such as nitrile are recommended for wear during chemical handling. Many offices are converting to nitrile gloves due to allergies to latex as well. For eye protection, serious damage to the eyes may occur if proper eye protection is not used. Protective eyewear with side shields and splash shields are available and they must be worn in patient care settings. Now we're wearing the face shield, so that's a lot of fun too, on top of the eyewear. Protective clothing, the type of chemical being used should guide the selection of protective clothing. A rubber or neoprene apron should be worn when one is mixing or pouring chemicals that are caustic and can stain or would saturate and penetrate and damage regular fabric. A lab jacket or cover gown should be impervious to fluids and worn in patient care settings. Inhalation protection. Use a mask or respirator as warranted by the material. The face mask should be fluid repelling and provide respiratory protection. Masks worn during patient care may or may not provide adequate protection when you're working with these chemicals, depending on the quality. A mercury spill kit, along with proper PPE, should be used when one is cleaning up mercury. The spill kit for small amounts of mercury should contain mercury-absorbing powder, sponges, and a disposable bag. Flammable liquids are used readily in dental materials. Many of the solvents used have a very low flash point and can easily ignite when near an open flame. The safety data sheet, or the SDS, which I think is now called the MSDS, for each product describes the flammability of that product. Acids such as phosphoric, hydrofluoric, and hydrochloric acids are used during manipulation of various materials. Contact with the skin, eyes, or clothing can cause severe burns or damage. Flushing with water immediately is essential to prevent severe injury. Eye wash units must be installed in every place of employment where chemicals are used. There is a wide variety of styles that irrigates the eye with a soft flow of water and bathes the eye without causing further damage. It's recommended that eye wash stations be inspected frequently to ensure water flow. Some manufacturers suggest running them for several minutes periodically to discharge any buildup and potential biofilms or infectious agents. Good ventilation is necessary when dealing with any type of chemical. Dental offices should be equipped with special exhaust systems for fumes and dust in the laboratory and radiographic areas. Lack of proper ventilation may allow chemical vapors and dust to cause contact dermatitis and eye, nose, throat, and respiratory tract irritation. Always store chemicals according to the manufacturer's directions. Expiration dates must be reviewed and out-of-date materials should be disposed of properly. Empty containers can be hazardous, so never use an empty container for anything other than its original purpose. If the material changes in appearance or texture, dispose of it according to the manufacturer's directions. Waste is considered hazardous if it contains certain properties or chemicals that could pose dangers to human health and the environment after discarded. Classified as ignitable, corrosive, reactive, or toxic, disposal of hazardous waste varies from state to state. Very heavy fines may be imposed for improper disposal of chemicals, sharps, or blood. Now what they're doing, I forget the year it's supposed to be done. I actually think it's by the end of this year. Many offices are required to put in something called an amalgam separator. Before, whatever was being suctioned up with the water was going back into the water system. So now they're putting in amalgam separators to keep that from happening. The dental office and dental labs must follow the same infection control guidelines to protect healthcare personnel and patients from bloodborne pathogens. Dental labs are obligated to make sure that the products that are delivered back to the dental operatory are free of contaminants. All equipment used in the dental lab must be single-use items or handled with standard precautions for prevention of cross-contamination. OSHA has created standards to protect the safety of workers. OSHA has been enforcing a hazard communication standard since 1983. In 2013, a new program became effective with the elements being phased in through 2016. The HCS is adopting the United Nations Globally Harmonized System for Classification and Labeling of Chemicals, otherwise known as the GHS. This system replaces the Material Safety Data Sheet with a more globally standardized safety data sheet. Written hazard communication programs must identify employees who are expected to use hazardous materials. Identify employees by name who are exposed to hazardous chemicals and describe how chemicals are handled in the workplace. Include safety measures and how to respond to chemical emergencies. The chemical inventory is a comprehensive list of every product used in the office that contains chemicals such as amalgam, bonding agents, disinfectants, and impression materials. Safety data sheets provide health and safety information about each chemical product in the office and comprehensive technical information. They describe the physical and chemical properties of a chemical, health hazards, routes of exposure, precautions for safe handling and use, emergency and first aid procedures, and spill control measures. You can look at figure 410 in your textbook, and this kind of goes over how the safety data sheet looks like, what it looks like. Labeling of chemical containers. The responsibility of labeling chemicals is with the manufacturer or distributor. All chemicals in the dental office must be labeled. In many cases, the manufacturer's label is suitable. When a chemical is transferred to a different container, the new container must also be labeled. Labeling exemptions include products and pharmaceuticals directly dispensed to the patient by the pharmacy and drug intended for personal consumption. National Fire Protection Association labels. This is a system that is frequently used to label containers. It consists of blue, red, yellow, and white diamonds filled with numerical ratings from 0 to 4. For employee training, training is essential for successful hazard communications. Staff training is required, 1, when a new employee is hired, 2, when a new chemical product is added to the office, and 3, once a year for all continuing employees. This is a picture of the hazardous material classification. So on some products, you're going to see a red, blue, white, and yellow diamond, and it'll give you a number in each area. And this just breaks down, how hazardous this material is. The process of preventing the transmission of disease and performing dental procedures involves equipment and products that produce waste, consume less energy, and use toxic chemicals. There are traditional and environmentally friendly products, supplies, and procedures available. Chris H. Miller from the Indiana University School of Dentistry has developed a list of do's and don'ts as they relate to recyclable and biodegradable materials, energy and water conservation, waste management, and infection control standards. So if you, in this chapter, if you look at the eco-friendly do's and don'ts box in the textbook, that will go over what Chris Miller has come up with there. All patients should wear safety glasses. The type of safety glasses is dependent on the patient and the procedure. Some patients prefer tinted glasses, others don't really care. They can even wear their own as long as they're big enough. If they have their own sunglasses, that's okay too. Keep patients' airway clear with high velocity evacuation. Use a rubber dam with hazardous materials. Cover the patient with a napkin that is plastic back so that materials don't get on the clothing or skin. and also have patients rinse with a pre-procedural mouth rinse. In summary, the management of a safe environment in the dental office is the responsibility of the employer and all who work there. Being familiar with each material or chemical used by the dental team is essential. So if you have any questions over this week's material, please feel free to email me at hwells14@ivtech.edu.